Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about surgical schedulers. I'm going to give you the job duties, education requirements, some of the likes and the dislikes, and then some detailed salary information so you can know how much money these individuals make on average. So let's get started. First up, what are the job duties of a surgical scheduler? Well, as you may have guessed, they schedule surgeries and follow-up appointments and things like that, but they also do a lot of other administrative tasks, and it depends on where they work, but a lot of times they will kind of take on a role of receptionist or bookkeeper and things like that as well. So some of the common duties: they will answer telephone calls and common questions, they will assist patients with documentation and sign-in sheets, they'll file paperwork, submit billing and insurance claims, and they will also perform those basic bookkeeping tasks in addition to scheduling surgeries and follow-up appointments and things like that. So what are some of the education requirements if you want to become a surgical scheduler? Well, in most cases, all you're going to have is a high school diploma or GED equivalent. That seems to be the basic requirement at most healthcare facilities. Now, a lot of times they will want you to have maybe 1 or 2 years of clerical or receptionist or administrative type experience, but that's not always necessary, but it does help. In addition, you can't always get certified. Now, this is a position you don't really have to have a license or certification or anything like that, but there is one certification, which is the Certified Administrative Professional, also called CAP, and that's offered through the International Association of Administrative Professionals. You can't always do that. You usually have to have 2 to 4 years experience before you get that certification, but that could help your job prospects a little bit. Okay, now what are some of the skills you'll need for this position? Well, first up, you're going to want to be able to type, obviously, because you will do a lot of typing as you schedule surgeries, fill in documentation and things like that. You'll also want to be able to use a lot of technology because you'll be working on computers and maybe using software to schedule surgeries. The telephone lines may be rather sophisticated and you'll have to learn how to put people on hold and things like that. Also, it helps to have good organizational skills. You want to be able to multitask. You will have to deal with patients, so it helps to have good customer service skills. And you want to be able to know some basic medical terminology. That can help you as well. Now let's talk about some of the likes and the dislikes for this profession. And one thing that most people like is that you do usually have nice hours because you only call and schedule appointments mostly during the day. So a lot of these individuals actually work in doctor's offices and things like that. So the hours are often like 8 to 4, 9 to 5 type hours. These individuals tend to like working with patients and they like dealing with them and having that face-to-face conversation. They also feel that it's a relatively stable job, so they usually have quite a bit of job security. And there's a very low education requirement, so you don't have to go to school forever to become a surgical scheduler. Now, some of the dislikes are, first of all, some of them feel that they are understaffed and they will have a lot of workload. They'll have to call people, schedule appointments, file paperwork, and sometimes they feel like it's a little too much. Sometimes it can be stressful juggling calls. You may have a couple of patients walk in, you may have the phone ringing, and you got a load of paperwork to do, so trying to juggle all that can be quite stressful. Another thing is that sometimes patients will schedule surgeries or reschedule surgeries at the last minute or not show up when they're scheduled, or a surgical scheduler will instruct a patient on how to fill out paperwork, but then the patient will completely do something different. So that can be a little bit of a frustration. Okay, now let's talk about some of the jobs data. And this comes from the Bureau of Labor Statistics, which is the government organization that collects and records jobs data. And it's accurate as of 2014. The average hourly wage for surgical scheduler and all medical secretaries was $15.50 per hour. The average salary, $32,240. Now, there was 516,050 jobs for medical secretaries as of 2014. Now, what industries had the highest employment level? First of all, offices of physicians came in at number 1. $32,340 was the average salary there. General medical and surgical hospitals, $33,800 was the salary there. And then offices of dentists, $37,920 was the average salary there. And that's where the majority of medical secretaries or surgical schedulers actually work. Now, what are the top paying industries? Well, junior colleges came in at number 1. $40,980 was the average salary there. Scientific research and development companies, number 2, $40,930. And then consumer goods rentals came in at number 3, $39,320. Now, what are the top paying states for medical secretaries and surgical schedulers? Well, Washington came in at number 1, $40,700. was the average salary there. New Jersey, $39,850 was the average there. And then Massachusetts, $39,730 was the average there. The lowest paying state was West Virginia. The average salary, $28,160. Louisiana, number 2, $28,480. And then Kentucky, number 3, $28,820. Now, again, those are only averages. You can make more or less depending on your state, your industry, your experience, and things like that. If you want to see the average hourly wage and salary for all 50 states, you can go to an article on our website. I'll put a link in the description, or it should be popping up here somewhere. You can go and check out that article if you're interested. I also have a whole nother playlist on other healthcare salaries. You can look at things like surgical techs and nurses and doctors and all sorts of professions within the healthcare industry, and learn about the job requirements and salaries and things like that. So thank you so much for watching, and please consider subscribing.